How long does it take to get a misdiagnosis? Have you ever wondered how long it takes to get a diagnosis for multiple sclerosis, often called MS? This chronic disease affects the central nervous system, including the brain and spinal cord. Diagnosing MS can be quite complex because its symptoms can vary widely and mimic other health conditions. The journey to a diagnosis typically involves several steps and can take a considerable amount of time. It usually starts when someone notices symptoms like vision problems, numbness, tingling sensations, muscle weakness, balance issues, or fatigue. These symptoms can come and go, making it challenging to identify a consistent pattern. Because of this, many individuals may find themselves visiting multiple doctors before receiving a definitive diagnosis. Healthcare professionals use a combination of medical history, neurological exams, and diagnostic tests to diagnose MS. One of the most common tests is a magnetic resonance imaging scan, which helps visualize the brain and spinal cord for any areas of inflammation or damage. Other tests might include lumbar punctures, which analyze cerebrospinal fluid, and blood tests to rule out other conditions. The duration for getting a misdiagnosis can vary significantly from person to person. For some, it may take just a few months if the symptoms are clear and the tests yield conclusive results. For others, particularly those with atypical symptoms or milder cases, it can take several years. Studies suggest that, on average, the time from the onset of symptoms to a confirmed misdiagnosis is often between 1 and 5 years, though it can take longer in certain situations. Several factors can contribute to delays in diagnosis. The intermittent nature of symptoms, the absence of a single definitive test for MS, and the necessity to rule out other similar conditions can all complicate the process. Early diagnosis is crucial because starting treatment promptly can help slow the progression of the disease and improve long-term outcomes. For those living with MS, the uncertainty and waiting involved in the diagnostic process can be frustrating and emotionally taxing. Many individuals report feeling a sense of relief once they receive a diagnosis, even though it means facing a chronic condition. This clarity can open the door to treatment options and support. It is essential to remember that only a qualified healthcare professional can diagnose MS. If you or someone you know is experiencing symptoms that may relate to MS, seeking medical advice as soon as possible is vital. Early evaluation and diagnosis are key to managing the disease effectively. In conclusion, the time it takes to get a misdiagnosis can range from a few months to several years, depending on individual circumstances. The process involves thorough evaluation by medical professionals and a series of diagnostic tests. While the journey can be uncertain and lengthy, an accurate diagnosis is crucial for accessing appropriate treatment and support. Always consult with a healthcare provider for personalized medical advice.